Okay, perfect. Okay, good morning again to everybody else who came in. My name is Dr. Teresa Northington, and I'm the Developmental Screening Coordinator here at the Bureau of Family Health. And we're so excited to have you all here for our fourth session of the Developmental Screening Summer Series. Today's session is titled The Pediatric Medical Home, the Importance of Care Coordination. And to share with us on the topic, we have Kaylee Hall here, who is the Care Coordination Consultant for the Bureau of Family Health. So, Kaylee, take it away.
Thank you for that introduction, Dr. Northington, and thank you everyone for being here bright and early. I know we're at the 8:30 time slot, so I appreciate you all, and I'm excited for today's brief presentation, and then we'll also leave some time at the end for question and answer. So I can't see your faces, but I recognize a few names on the call already, and I appreciate you being here. Thank you so much. So as mentioned, today we're going to be talking about the pediatric medical home and the importance of care coordination. We're going to be discussing for about 15 minutes and then leave some time at the end. I'm going to go over an introduction to what is a pediatric medical home. We're going to do an overview of the Bureau's provider toolkits. We now have 3 that are online. I'm going to do a walkthrough of the care coordination toolkit. The Care Coordination Toolkit is our most recently toolkit that's been published online along with the Developmental Screening Toolkit. We also have the Youth Health Transition Toolkit as well, which I'll talk about in a little bit. I'm going to review current care coordination resources throughout the state. And again, we'll leave some time at the end for a discussion. Feel free to chat in as I'm talking, and I'm sure Dr. Northington will help me catch those chats coming in, and it can be as interactive as you all want. I know it's bright and early. So what is a pediatric medical home? The American Academy of Pediatrics defines a medical home as an approach to providing comprehensive and high-quality primary care that is accessible, it's family-centered, continuous, comprehensive, coordinated, compassionate, and culturally effective. The concept of a medical home was introduced in 1967 as being that central location of holding a child's medical records. In 1992, the AAP published a statement defining the medical home, which was then updated again in 2002. In 2010, the Patient Protection and Affordable Care Act was signed into law by President Barack Obama, emphasizing the implementation and promotion of a medical home for children and adults. The medical home is a team-based healthcare delivery model organized across all elements of the broader healthcare system. Again, it includes that active collaboration between families, primary care providers, clinical specialists, behavioral health providers, hospitals, and community programs. So all of the players. Family engagement and family-centered care are extremely important pieces of the medical home, terms you've probably heard before. Parents and caregivers, as we know, are the people who know their child best and should have an active role in their child's healthcare decisions. Creating those effective partnerships between families and clinical practice teams through strength-based approaches can not only improve outcomes, but it has been shown to increase patient satisfaction and decrease overall healthcare costs. For Medicaid providers, the medical home model offers an effective framework to support delivery of early periodic screening, diagnostic treatment, or EPSDT, preventative healthcare services. So as you see on the slide, family-centered care is centered on the goals, needs, and preferences of the child and their principal caregivers, and again, is an extremely important element of the pediatric medical home. Providing care in a medical home, as we mentioned, is important for all children and families, but it most certainly is essential for children and families with special healthcare needs. The American Academy of Pediatrics and national standards for systems of care for children and youth with special healthcare needs endorse that care in the medical home as being a gold standard for ensuring holistic and coordinated healthcare for pediatric populations. Care coordination is a core element of the pediatric medical home model and also a core component of federal and state efforts to, again, improve health outcomes, reduce that caregiver and patient burden, eliminate redundancies in care, and also decrease those healthcare costs. Supported outcomes of delivering quality care coordination services. They provide that access to coordinated, ongoing, comprehensive care within a medical home setting. There's that family professional partnership at all levels of decision-making. Again, if you think about the previous slide, that family-centered care being at the center. Access to adequate financing and private and/or public insurance to pay for needed services. So there's the additional benefits, information, and linkage component. Early and continuous screening for special healthcare needs. Catching some of these risks earlier on, leading to better health outcomes. Organized community services for easy use. And there's also that transition component from youth to adult healthcare through work and independence. So as I mentioned, this is a snapshot of all of the Bureau's current provider toolkits available online. These are available at no cost as they are sponsored through Title V funding. Today, I'm going to focus on the Care Coordination Toolkit, but we do have a full developmental screening toolkit online, again, a Care Coordination Toolkit, and our Youth Health Transition Toolkit, which we are actually in the process of updating to meet the format of the other two. So I definitely encourage you, I'm sure we'll send the slides out or the recording will be available. Please check them out. The links are on the slide as well. The Care Coordination Toolkit provides teams with the information needed to develop and implement improvement targets for care coordination service, really for any family requesting a linkage to a service. It was developed under the understanding that clinics are providing care coordination at some level already, whether it's scheduling appointments, or maybe you have more advanced care coordination happening in your practice where you have a designated care coordinator. But the thing that I love the most about the toolkit is it does recognize that all clinics are providing care coordination at some level, and it will build off of those services depending on where you are at. The toolkit is designed to support practices, again, with improving on or expanding those care coordination services at the clinic level. It uses a stepwise quality improvement framework designed to maximize your current clinic capacity and make the implementation of care coordination services both efficient and effective. The toolkit was created for primary care practices, but it can most certainly be used by other healthcare or social service professionals, particularly the resource page. Like I said, I recommend everyone click in and check out the resources, some of which we'll highlight on today's call. The purpose of the toolkit is to provide teams with the information needed to develop and implement those improvement targets for any family requesting linkage to services. It's intended to be customizable and will help you assess, plan, and implement services at your own pace. A practice can determine care coordination service goals based on technology, staffing, spatial capacity, and don't worry, there are tools available throughout the toolkit to help you do this. You can actually go in and print off blank worksheets ahead of time if you prefer to work that way, or it will guide you through the toolkit online. So how can you get to it? The Care Coordination Toolkit is found on the Bureau of Family Health's website. Again, there's a printable version of the entire toolkit also available. It does implement a 3-step framework for integrating or expanding care coordination services. There also is a training and support page and a resource page, which I encourage everyone to please check out. If you have your phone available, please feel free to snap a picture of the QR code on the screen and it will take you directly to the toolkit online. And on the right side of the screen, when you click into the toolkit, this is what that home page will look like. Across the top of the screen, you're going to see our navigation bar. So as I mentioned, the toolkit does use a 3-step framework for integrating or expanding these services into your practice. We've created checklists and worksheets to help you through each of the steps listed below. You can also use this toolbar to navigate between steps. And you can download and print all of the blank worksheets ahead of time. And there are also examples of each document to help guide you through that process as well. As you navigate the toolkit, you will find many resources available to help guide you through the process. We also have a team of experts available to provide implementation, training, and support. This is going to consist of a variety of options to allow you to interact with our experts to receive support tailored to your practice's needs and wants. We can provide guidance, help with those decision-making and problem-solving questions that may come up through the planning phase, and coach you through the implementation changes in your practice. As a reminder, a QI project or quality improvement project around care coordination can serve as a component of maintenance certification credit. So as I mentioned, the care coordination toolkit, along with our other toolkits available online, offer additional resources related to care coordination to support children and youth with special healthcare needs. The toolkit offers resources that include care coordination resources, local referral resources. Actually, the snapshot of the map on the right side of the screen, there's an interactive regional resource guide that's available on the page where you can click into your parish and it'll pull up a printable PDF document. Other state agencies that are providing care coordination, we have family engagement resources that are listed out, as well as easy to print resources that you can share with families. All resources on the website, it does include a description and a direct link. So I did want to point out the Family Resource Center. Hopefully many of you on this call are familiar with the Family Resource Center and may already be using their services, but the Bureau does sponsor a statewide resource center. In addition to health information, the Family Resource Center staff can connect families to resources related to insurance, finances, education, food resources, and more. The phone numbers listed at the top of the screen, the 896-1340. The staff is available Monday through Friday, 8 to 4. You can leave a voicemail on that line. We will return your call. The team of staff with the Family Resource Center is truly amazing. I do feel that, you know, any child, any family looking to link with resources in the community would benefit, whether it be health, early childhood education, insurance, care coordination. I do see, Miss Bell, do you have your hand raised? Do you have a question? If you do, feel free to chat it in. But like I mentioned, I encourage anyone to reach out to the Family Resource Center if you know a family looking to connect with resources in the community. I'm a little biased because they work closely with the team, but they are truly a wonderful group, and they will answer your call. You can also email, and I'll make sure we get that information shared out. So I did want to leave some time at the end. If anybody does have any questions, feel free to chat them in, unmute yourself if you can. I do want to point out Julie Emery. She is a medical home and EPSDT coordinator. She did actually prepare the medical home slides that was presented on today. She's a great resource if you have any questions. You just want some more information about medical home or maybe the work that the Bureau is doing, please feel free to email her. She is out of town, but she is available via email, julie.emery@la.gov. And again, if you have any questions after today's call, you think of anything that comes up later, my name is Kaylee Hall, and I am more than happy to answer any emails, share resources, give you contacts with the Family Resource Center, share the toolkit. So please feel free to reach out to Julie or myself. I want to thank you all so much for your time today. I know this was a very brief overview. It's a topic I'm very passionate about, so I'm happy to engage in any further discussion. I want to thank Dr. Northington for inviting me to be on this call today.
Of course. Thank you so much, Kaylee. Great presentation and information shared this morning. I'm just going to go in and check the chat in the Q&A section to see if there are any additional questions. Don't see any here, but please make sure if you are seeking CE or CME credit that once the webinar concludes, that you make sure to complete the evaluation. If it doesn't pop up for you, we'll also send one via email post-webinar session, and we'll get that credit certificate to you. So once again, thank you all so very much. Thank you, Kaylee, and thanks to all the participants this morning. Hope you have a great and wonderful day. Thank you.